Hi, Shiloh.
Hi, how are you doing? Happy New Year.
I'm doing great. Happy New Year to you too. How are you doing?
I'm great. I work for EverydayFamily.com. We are a pregnancy and parenting website, and we talk a lot about pregnancy and parenting. It's pretty cool to talk to you today about, the new year and people's plans and plans to get pregnant. And, there's certain things that women can do to help increase the chance of having a healthy pregnancy and a healthy baby. So I'm hoping you can kind of share some of that with us and with our members.
Oh, yes, absolutely. So again, thank you for having me. And one of the biggest things that a woman can do is if she can actually plan to go in before she gets pregnant and get preconceptional counseling from her doctor so that we can actually tailor her plan for her pregnancy before, during, and after her pregnancy, then that's the best thing, so that we can take into consideration if she has lifestyle changes that need to be made, or if we need to change her medicine or something like that. That's one of the biggest things that we can do. And also to make sure ahead of time that she's on either a prenatal vitamin that has folic acid in it or a multivitamin with folic acid. And the reason being is that half of the pregnancies in the United States are not planned. And we know that folic acid can decrease neural tube disorders. And neural tube disorders start really early in pregnancy before women even know they're pregnant sometimes. So if we can, so the CDC and gynecologists have recommended, and we really want to sort of arm women or empower women by having all childbearing women of a childbearing age, that to be on a multivitamin with folic acid is really huge and can really, really decrease the number of neural tube defect affected babies out there. So
definitely. Now, yeah. Is there an amount of folic acid that they recommend?
Yeah, 0.4 milligrams is sort of the baseline, but if you're at increased risk, you may actually need more than that. Well, you do need more than that. And so also at the preconceptional consult, the doctor can identify who's at higher risk, from their past medical history or personal history, to see if they need to be on a higher dosage of folic acid to help decrease neural tube defects.
Now, is folic acid something that people can find in their daily diets, or do you find that a supplement is generally required?
You can get it in your diet, but when you're pregnant, that's a different ballgame. And we definitely say that you should be getting your folic acid requirement from a supplement, because you're not going to be able to guarantee, because of absorption and other things like that, how much you would get of the folic acid in your diet, and especially if you need a higher dosage. So that's why it's really important to take a supplement with a folic acid, prenatal vitamin with folic acid in it at certain levels, either the baseline or a higher dosage. And that's why I'm really thrilled to be here today with Duchenet USA and Integrity Folic 5, because it has a higher dosage of folic acid for those women who are at increased risk of neural tube defects.
Gotcha. Now, folic acid, will it always say folic acid on the bottle, or is there, does it go by different names? Sometimes, with vitamins and stuff.
No, it's going to say folic acid. Yeah, it'll say folic acid, and it should have the dosage. And, with my patients, I will, because there's so many different things out there, I will actually read the labels of the prenatal vitamins to make sure that everything's adequate in there. So that's how important it is, to really have those supplements.
And you kind of touched on that. Obviously, women that are able to first see that before they get pregnant, they go to their doctors, and their doctors can help put them in the right direction for a good prenatal. How else can we find? How do we know what's a good prenatal besides just folic acid and looking for that? Is there anything else that we should be looking for?
Well, you're definitely right. There isn't a one size fits all, because women are different. So, say you have nausea and vomiting in pregnancy, you may want one that has AM and PM dosing, so the pill is actually smaller, because some of those larger pills are really hard to tolerate. Or you may want one that sort of splits up the calcium and the iron, so that you have less of the stomach upset. Or say you have a gluten intolerance or a lactose intolerance, you may want one that's gluten-free or lactose-free. Or say you have religious or dietary laws that you have to follow, you may want one that's certified halal or kosher. And so these are things that everyone needs to take into consideration. That's one one reason why, you know, I am so happy about the Enterity Folic 5, and also they can go to the Enterity.com site to get information about prenatal vitamins and about pregnancy just in general. But again, contacting their doctor, because there's all these different things that they need to find out if they need a different dosage, and you know, these other ones that can do these different things like Enterity does.
Now, you had mentioned earlier that sometimes too the doctors will have you change certain things in your lifestyle. Is there anything that you know, our members can kind of get a head start on, certain lifestyle habits, like, I mean, obviously smoking and that sort of thing?
Right. Well, exercising. If you're not exercising, it's not like you want to start becoming, you know, a marathon runner during pregnancy, but you may want to still start to implement, you know, a little bit of something. And you may want to find, you know, or at least try and get your joints a little bit more limber with yoga, or get your cardiovascular a little bit better with some brisk walking. So that might be something that you want to implement. And then also knowing what types of foods to avoid. Like, you don't want to eat any raw meats, you don't want to eat any unpasteurized foods. So these are all things that, you know, the doctor can kind of, you know, when to travel, where to travel, can try and help, you know, educate you about during your prenatal consultation.
Wonderful. So if you could just, can you spell out that website that we can go to for more information?
Absolutely. It's Enteryti, Enterity.com. And again, pregnancy information as well as prenatal vitamin information.
Wonderful. Well, thank you so much for talking with us today. You know, this is a very important point to get out there because it's so simply prevented, you know, this issue. So the more women we can get with their folic acid before getting pregnant, the better. So we'll help spread the word.
That's right. That's great. Remember, all childbearing age women, multivitamin, folic acid.
Awesome. Thank you so much. Have a great day.
You're welcome. Thank you. You too.